Welcome back to the Spartan Nurse Podcast. Today we have a tried and true Spartan nurse, Callie Harris.
Callie, can you share your journey into nursing and how you transitioned into nursing research?
Yeah, my journey in nursing is very long and different throughout the whole journey, and research just came in at the end. I started off in nursing because I was in Science Olympiad in high school, and I was a big nerd, and I loved science, and I loved helping people, so nursing was the obvious choice. I went to MSU, College of Nursing, graduated with my BSN in 2010. Go Green.
Go away.
And then I definitely 100% wanted to be a CRNA, specifically a pediatric CRNA. I have never worked in peds. I have never worked in even like critical care. So I absolutely did not want to be a Med-Surg nurse. As you know, Mike, I became a Med-Surg nurse. I was a Med-Surg float for a while, and then I taught Med-Surg for a while. Started in 2013 at LCC. I started teaching Med-Surg, loved it, and decided to go back for my MSN in education. And then I was full-time teaching in 2016 at MSU. And then people just kept on telling me, you know, you can't sit still, and you keep on trying to fix things. And I think you might like research. And they were right, because I definitely do. And I love taking things apart and figuring out what's wrong and then putting them back together better.
So how has your perspective on nursing research changed?
It's changed a lot. In 2010, we didn't have as many courses, I feel, in general. And the one research-focused class I had was at 8 a.m., so I did not learn very much. And what I did learn was that I was very tired. And so I didn't get excited about it like I did with other things. And I thought, well, this is absolutely not for me. I'm not going to do this. Didn't even think about it. And then as I went through my career, I just kept on doing QI projects and wishing that I could do research, but not able to actually do the research. And then I saw all of my peers doing research, and I was like, that's really cool. And then actually Dr. Ann Thomas told me that I should go to the PhD program. And then Kathy Poindexter took the baton from her and kept on telling me that I should go to the program, and they were right.
That's awesome. And you say, you know, the word excitement, right? Like you get excited about nursing research. So what parts of nursing research do you really find the most fulfilling or the most exciting?
The parts of research that I find the most fulfilling are actually teaching. So I am a teacher at heart, and in research, I get to teach other people completely new knowledge that I learn. So that is really fulfilling. It's not just, you know, teaching something that everyone already knows at my level. I'm learning something entirely new and teaching people from that. And I think that's really cool.
What a great way to make an impact.
Exactly. And can you expand a little bit about having such a legacy of nursing research behind you, and then thinking about the students that you're going to impact to go into nursing research?
Like the ripple effect?
Yeah.
That is exactly what I've always wanted. As I proceed through my career, I'm like, how much of a ripple can I make? And in teaching, there are just so many people that you affect, and then some of them become teachers, and then same in research. So it's just a kind of continuous effect that compounds on itself, and I hope increases knowledge overall.
So why is researching LGBTQ plus health, particularly cancer disparities among bisexual individuals, important to you?
One of the things that I like to do is guest teach LGBTQ health class. And that is something that started because I started the PhD program. Nothing to do with my teaching. It was heard that I was studying LGBTQ health. And then they said, you know, you need to teach this to nursing students. And really, I noticed even when I was teaching, there is just nothing that nurses or doctors or anyone really knows about how to care for LGBT folk. And that is, that's true everywhere, and especially in rural places like where I grew up. And that really affects care. So a lot of people that I know personally and that I've heard stories of will struggle to seek care because they are afraid that they're going to be discriminated against. And that is a true fear. That's a realistic fear, because I know people who have been hurt in situations in healthcare, which is terrible. And so that affects their ability to go in for any sort of care, especially preventive care. And then if you're not going in for cancer prevention, you're getting late stage cancer, you're having worse outcomes. So we're really, by not focusing on LGBTQIA plus health in nursing school, we are kind of causing that ripple effect to make it so that their outcomes are significantly worse than others.
Oh, 100%. I mean, speaking personally, I've seen at the bedside how there's just not a lot of comfortability to even talk to queer people in the community. There's that lapse of education. I know myself, I've gone to a couple of doctors and they didn't know what PrEP was. And for our listeners, that's an anti-HIV and AIDS treatment that people in the community take so they don't contract HIV. And so that's really awkward when you're in the doctor's office and you're like, hey, I want to get on PrEP. And they're like, what's that? And you're like, oh, this is not the place for me, actually. And it's taken a lot of trial and error for even me to find a provider. And luckily, I'm really well connected in the community. So I had my therapist who actually said, go to this doctor because they're also gay and you won't have any issues. But there's a lot of people who don't have that kind of connection or ability to really be able to get that kind of care.
And they say that nursing is the most trusted profession, but you have to wonder, what are we doing to build trust and, with lots of other, people with different gender identities or, racial or ethnic minorities, and what are we doing to build trust in all of these areas, not just in general, okay, nursing is the most trusted profession. And so I think that this really highlights a really important topic.
Yeah, I think that a lot of people in nursing will say, I am, I don't discriminate with my patients. I treat everyone the same, and I care for all of my patients, LGBTQIA plus people included. But if you don't actually know the things that you need to know to safely care for them, then that's not necessarily true. So I think that's where we're at in nursing. And
while you've been researching, what other key disparities and what other factors kind of lead to these challenges?
The major thing that really causes all of the disparities is minority stress and stigma. And that can be like an individual person experiencing hardship because of their own sexual identity or gender identity, or it could be like law related or just how society brings people up. Like in grade school, let's get 2 lines, boys and girls. It starts early, and it's not purposeful necessarily, but it is just how it's ingrained in our minds. And so that sort of normative assumption of how things are is so distressing on the inside and outside for people who are not exactly like those norms or don't, feel that they meet the society's standards. And I think that's mostly the cause of all of this, all of the disparities that you see. And those disparities can be even worse for people if they have more than one identity that is a minority identity. And even what I'm studying is bisexual people. And they have unique issues in that they get stigma from both within the community and outside of the community. And that could be true of any individual, but bisexual people experience it a lot because people who aren't LGBTQ often, discriminate against people who are. That's a known fact. But then within the community, bisexual people are often still looked at as, well, you're in a phase, or if you go to the doctor, they think that you're just promiscuous, which is not the same thing. It's just not well understood, and it's not well respected. And even if someone is respected in the community because maybe they're in a same gender relationship, they're assumed to be gay or lesbian. And so their bisexual identity is then erased. So that is a huge issue that causes worse problems in bisexual people, especially with mental health.
And that doesn't make you feel very safe when seeking care, right?
Community is a really positive thing that helps people to avoid those disparities and to get the care they need. But a lot of people don't have that support, or they don't even know how to access that support. And so that's a huge issue. If you don't have access to a doctor who knows who a doctor is that you can go see, that can be really detrimental.
Yeah, I think it's good that you're raising awareness on that issue for sure. So, how do you handle, you mentioned kind of the lack of research in this area. How do you handle the lack of existing data when studying LGBTQ plus health issues?
I cry. It took me about 3 years just to write one lit review because there is so little information out there that where some researchers might do a search and they have to narrow their topic down because they have to get, as a reasonable amount of data that is not too large to look at. I had to very much widen my topic, but there just aren't enough studies out there to support even what the gaps are. So my biggest gap is that there is no literature. And to find an actual gap in care is hard if you don't have any research about that care. So that's really difficult, but I've mostly been broadening my ideas, looking at different minority identities that are similar, different experiences, and kind of comparing. And really my focus on my paper that I just wrote is looking at specific identities, and that is a very difficult thing to do because none of the research divides among the identities. So that was a bit of a challenge as well.
Yeah, and it sounds like discovering that provided a huge opportunity for future research.
Absolutely, yes.
In that area, for sure.
So we've talked a lot about the lack of care in the community for LGBTQ individuals. Can you talk about the strategies that you're implementing to be able to educate future healthcare leaders?
Really, the biggest thing is having awareness and having someone who you can identify with. And I think that is the biggest thing I've noticed in doing lectures for LGBT health. After every single one, without fail, I will have at least one, if not more, students come up to me and say, hey, thank you so much for doing this lecture because I have not felt well represented in this program or in life, and it's really important that other people learn these things. And it's not just limited to health. It's, representation is really important within the program because we're going to lose nurses who even care about this topic if we're not teaching it. So it's kind of like a snowball effect. If we're not supporting LGBT nurses, we will not have LGBT nurses.
And I think we already see the negative effects of that ripple effect of not having LGBT care or LGBT providers in the community, in the healthcare community already, because there's that lack of research.
Yes.
And just thinking about even our course textbooks, there's not a lot in our course textbooks on LGBT. And so I think that there's really a big opportunity there to expand education in that area, because even when you look at the textbooks themselves, which is what our lectures are based out of, there's not a lot there. And so really there is a big knowledge deficit there that needs to be addressed.
And beyond that, thinking about me being, someone who can be supportive of others, it is very stressful to be the only person who's teaching this or who's researching this as well, because I'm looked at as the person who can teach everyone everything about LGBTQ health. I do not know everything about, it's impossible to know everything about all of these many different populations. And so it's hard to be, I get a lot of imposter syndrome because I am not all of the letters in LGBTQ, but I am trying to, bring their voices up as best as I can.
And it's hard because even like I know in my career, I've been looked at as like an LGBTQIA leader. However, I'm like, I can only speak for a queer person's perspective. I can't speak on behalf of the trans community. I can't speak upon the lesbian community. And I can't even, and if we think further, I can't even speak on the communities of color that live within the LGBT community that face even worse marginalization as a result of just their skin color and the racism that affects at the bedside.
And, and just reflecting back as faculty in the College of Nursing, we can do a better job of educating our students. And I'm not a member of the LGBTQ plus community, but that doesn't mean that we can't address those issues and concerns. And we can't provide greater education in that area. Even being a straight white male, I can still highlight those areas. I don't have that personal experience to bring to the table, but I can still help my students to become more empathetic and more sensitive to all different populations.
Definitely. I mean, it's basically like me teaching about other populations that I am not. Everyone should, because that's what health is. That's what nursing is. Everyone is completely different from everyone else, and we just need to recognize those differences and make sure we address them in their health.
And also our personal bias that exist because we're raised in such a white, cis, heterosexual, and male-dominated society that we don't look at healthcare for other people outside of that lens oftentimes, I've found.
Mm-hmm.
That's very true.
I can go on a rant about that.
So how can nursing education programs better address the needs of LGBTQ plus patients? And, and really as faculty in the College of Nursing, I'm really interested in this as well. So how would you recommend that this goes about being addressed?
We need to start by teaching our faculty what to teach. And then we need to start early in the program because right now it's just one 1-hour course, and that is not cutting it. And it's not really getting the message that we need to integrate care, integrate the different populations into the care that you're giving always. So I think it would be really helpful to have maybe a panel of people to look over the syllabi, and see where can we kind of make this a little bit more affirming and more helpful for all populations.
What are your main goals for your research and also your advocacy work for the community?
I think you answered the first question with the second question. I think my research is a means to an end. I really want to advocate for this community and increase access to care in general. I'm starting small with cervical cancer screening among bisexual people. I'm going to work my way out as I can because it's so hard to be the only researcher in this area, or one of a couple in the whole nation. So as much as I can increase general knowledge and support for preventive health, then I can increase access to care. And then I can also, the more that I do research, the more that I disseminate research, I am more visible and able to provide, advocacy work. Like my sister works at a hospital, and she was like, well, you have been doing research, so can you give a talk to our physicians who really need it? And so I did that, which was not planned. It wasn't prompt. It was just because she realized that there was a resource that could help, and so the more that I am visible, the more that I am able to help and make that bigger ripple effect.
Absolutely. Such a tremendous way to make an impact. So, kind of going from that question, what advice do you have for researchers or healthcare professionals to focus on LGBTQ plus health disparities?
I think the biggest thing to improving care is knowledge and immersion in the culture, because think of it as a language. If you learn French, you're not going to be able to understand and really be in the French culture if you never speak it and you're never around anyone who's French. If you go to France, then you actually might be able to learn more and appear comfortable in the presence of others. And that is a huge thing, because maybe after my lesson, you might know technically how to talk to people, but if you don't ever practice using they, them pronouns, you are not going to appear comfortable using them, even when you try. And that's going to make your patient uncomfortable. And so the more that you can really immerse yourself into things, educate yourself, that's going to really improve your ability to safely care for people.
And it's also about making sure that you don't make a big spectacle out of a mistake. If you misgender somebody, you just correct yourself and you move forward.
Right.
Because when you draw more attention to you draw more attention to the problem, you draw more attention to like wanting to be perceived a certain way instead of actually doing the work behind it.
Not main character.
Exactly.
So how can the community and the general public in general help reduce health disparities in the LGBTQ plus community?
Same way that the healthcare providers can. The more that you know, the more that you can support others. And don't be afraid of things that you don't know about. I think people don't associate with people who are LGBTQ because they're afraid they might say or do something wrong. Go make a friend. And if they say, oh, you use the wrong pronouns, then fix them and then keep being their friend. It's unfortunate that community is so important, because community is currently really the only support that the individuals in that community have, if that makes sense. So LGBTQ people are the ones who are supporting LGBTQ people. And so if they can actually have more friends and community and support outside of that, that would be really helpful.
And for our Spartans listening, check out our previous episode for resources about how you can educate yourself as faculty in your courses for LGBTQIA students.
Yeah, that's great. There was a lot of great resources provided there. And I will say, too, just being open to learning is so huge. I can't tell you how many times I've had students even ask me before a simulation. So, how do we address pronouns? How do we do that? And just wanting to learn more, I think is what we need to all do, is be willing to be open to learning and learning how to be more respectful of everyone around us. And I think sometimes it's people have the intent of being they just don't know. And so they need to be open to saying, you know what, I don't know what pronouns, I don't know how I should be doing all this. That's okay. We can help you to learn what pronouns should be used, or, how to address different things. And I think that's a key thing in nursing, is sometimes we just need to be open to those things, and healthcare workers in general. So
not just being open, but also retaining the information that you do learn. Because I think one of the most frustrating things that I've had to deal with in research is that I have to continue teaching the same things over and over again. And when I'm presenting on my research, I have to spend the majority of my time explaining the population, because even though I may have taught these people the terminology multiple times, they still don't remember, and I have to keep reminding them before I can even get to discussing what I'm doing with my research. So don't just learn it, but retain it.
To find your breaking news and latest updates within the College of Nursing, please refer to our website at nursing.msu.edu. You can also find us on all social media platforms at MICHST Nursing. Who will?
Spartan Nurses will.